This is Rayo. I just want to give you some feedback with reference to the latest hospitalization. And I'm sure that you guys probably experienced this thing. First of all, let me say this is that it's clear to me now that you're going to encounter similar situations in whatever hospital you go to. Um, that's just the way things are because I've encountered certain things in multiple hospitals. One when I was taking my mom to the hospital, and then versus when I actually had to go. So here's the thing: is that my latest visit was interesting in this aspect. I went in on Friday, not expecting to go in. Just by chance, I was at the hospital and I suffered some issues that had to Duke Hospital in particular, Duke Hospital in Raleigh, North Carolina. And here's the thing: is that one of the interesting aspects is this is on the weekend shift. I had two cardiologists present. They were human beings, able to relate, cool, And on Saturday, they had to take some fluid out of my body because my heart's, not right, and it has trouble with retaining fluid. And that stems from an issue problem that happened in February with influenza. Here's the thing: is that Saturday comes, great cardiologists meet them, two of them. Sunday the same two great guys, awesome. And here's the thing: is that I made a deal. Sunday I could have gone home, and I said, well, and they offered the opportunity. They said, well, if you stay an extra day, we get more fluid off of you. Great, awesome. Stay an extra day, get a little bit more medical attention, and sort of guarantee I don't come back to this place, right? They tried me on a new medication, which is non-sulfur. I'm allergic to sulfur, so finally they got the sulfur thing taken care of. And it's a non-sulfur medication. Here's the thing: is that when I agreed to consent, you open dialogue consent, and terms of it was, to my belief was, since the medication was working so well, that I'll just be on the medication another day, no problem. They get some more fluid and go on Monday, right? I mean, they had already on Saturday said we're talking about. You can on Sunday morning you can go home today or stay an extra day. So basically, I was supposedly at the level of being safe for discharge. Here's the thing: incredibly, I agreed to stay, but they lowered the dosage of the medication to half. So it was working fine until they lowered the dosage by half. Guess what happened? Come Monday morning, there was a severe insufficiency of water that was removed. Not my fault. Your fault. Here's the thing: those medications also cause other problems, like problems with the carbon dioxide level in your blood, problems with potassium in your blood, or lack thereof. And so it depleted my potassium. I had to take potassium, and it put my carbon dioxide level at the border. So here comes Monday, a new group of doctors. First one that comes in, you're not going home, not for a while, not with that swelling. Like, wait a minute, you just contradicted what the other two guys said this weekend. Okay. Second one comes in, my cardiologist. Oh no, we didn't get sufficiency of fluid out of you, so we better go ahead and take more fluid out. Like, okay, so then I'm thinking, like, it's not my fault. what the hell am I stuck? I made a deal, stay an extra day, based on A and B on the weekend shift. Everything was looking good. Now you're saying everything's not looking good. We have to take off a whole lot more fluid from you in order to make sure you don't come back. You're contradicting what the other two said on the weekend. There's a discrepancy. Push come to shove, I say, okay, I'll stay. One more day. Get some more fluid up. Fine. Come Tuesday morning, this is where the problem lies. My cardiologist, Mary, whatever her name is, she says to me, well, medication you're on is not working good enough, which it was before. And so I'm going to supplement that medication with another one. So I asked, well, is the new medication you're talking about going to have sulfur in it? She wouldn't answer the question. Are you making sure it doesn't have sulfur? I asked, does it have sulfur? She wouldn't answer the question. First red flag. Nurse Emily, she comes in with the medication shortly thereafter. And she says, I asked her, does it have sulfur in it? And she says, I don't know. But it wouldn't dispense because our system flags it and stops it. So if I have it in my hand right now, ready to give it to you, that means it went through our system. That means guaranteed it doesn't have sulfur in it, because it wouldn't allow the dispensing of medication that has sulfur to you. Why? And she was adamant about her system. Emily was. She was really like, yeah, our system is great. I said, can you tell me the name of the medication? She starts giving it to me. I stopped typing it into my phone. Typing, of course, the obvious question. Does melatonin, whatever you call that shit, have sulfur in it? Comes back immediately. Yes, it does. I'm sure the doctor knew that. Because she was insistent, well, you tolerated Lasix and Bumex well, so you should be able to tolerate any and all sulfur medication, even though you have sulfur allergy. It's just this. One thing you don't want to hear is from a doctor saying, I'm going to give you something regardless of whether or not you want it. That's like saying, if I say, I don't want pain medications, but you're going to insist on giving me pain medications. If I said no, regardless of whether or not you believe I'm allergic or not to it, I said, I don't want under any circumstances any medication with sulfur in my body. That's it. Am I right? But no, you tolerate it well, so she makes the attempt, the Dr. Mary, to put me on a sulfur medication. I go postal, of course. Got a little bit carried away, maybe the way I would carry myself. I said, give me the discharge papers right now, to Emily, the nurse. Give it to me. And she sort of like didn't know what to do, was sort of in a panicky mode. So she rushes out to the room, goes to a printer and tries to consult with whatever or get whatever authorization he needs. Come back with a discharge paperwork of AMA against medical advice. Here's the thing. In all the notes of these doctors, which I read them, I go and do my chart. Read the notes. It doesn't say the patient perspective. It only says the doctor perspective. You can't input the patient perspective. You can't input. By the way, Mary's trying to kill me by putting me on sulfur medications, and I'm leaving because of that. Not because I don't think I don't need more water, no, because you're trying to kill me. Here's the thing, it was the one in February, the hospitalization in February. It was a mixed result of hospitalization, in that they gave me a diuretic to remove the water due to the heart failure. That didn't have sulfur in it, but they also gave me a albuterol that did have sulfur in it. So You had mixed discharge. You know, it contained both. When I went in on Friday this past week, today's the 15th, um, in the emergency room, the lady, Amelia or something like that, she said to me, Mr. Oliveri, I guarantee you, we will not give you any sulfa medication. Meanwhile, they gave me Bumax. Now, here's the thing. In an emergency situation, she gave me Bumax, which has some sulfur in it. But here's the thing. He said I needed it because I just couldn't breathe. I just couldn't. Was on the tail end, tippy-toeing of crossing over this world. So within 15 to 30 minutes, I'd say, I was breathing much better. So I still got water in my lungs. And apparently these diuretics have to get water out. Modern technology, I guess. You get a diuretic to get the water out. Anyway, here's the thing: is that I thought you would have to use like massive antibiotics or whatever. I don't know. They know these beta alpha blockers, Buddha blocker, boga boom, abunga beta boom 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 boom. I have no clue what all those boom 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 are. I don't deal in that world, but I deal with more so this, which is what I got after hospital say, which is total beats instead of the high blood pressure medication. Because here's the thing: is that you're giving me these medications that cause side effects like lower potassium. I can't test myself for lower potassium. I can't test myself to find out when my carbon dioxide level is too high. Can't do it. I asked the doctor, I said, look, if the CO2 level is at 30 or 31 at the borderline, does that mean that it might be prudent to give me oxygen PRN? Didn't get a good answer from that. So it's like, either way, you're putting me on medications that I can't check levels of the side effects and those markers because I can't pull my own blood. So it is scary because you're giving medications that can be very detrimental to me. But the main point is this, is that you have to be very careful. I had 2 doctors on the weekend, everything's going good, just a little bit more fluid, and go out on Monday. Then Monday, a new set of doctors. All of a sudden, it's as if it never was talked about over the weekend. I knew, you'll be here for a while. We're gonna keep you for quite a while, maybe 7 days or so, the way they were talking, to get all that water out. It's like, dude, that would have been semi-fine had you not tried, had you not try to have me take sulfa medication again. And so these medical records, you read them nowadays. Now I know that all these professionals in the hospital cut and paste from each other, regardless of whether or not they were part of a conversation or not. They'll cut and paste from each other. One example is this: is that they cut and pasted I was uncooperative about heart failure education, which is not so. Because when I had met with some lady named Charlotte, she got so inwoven in my concerns and with what was happening, from basic concerns of not having a bed that worked when I have severe scoliosis, and the mattress wasn't pumping right, to, hey look, they keep trying to put me on this stuff I'm allergic to. So she got so caught up in writing notes in that she voluntarily discontinued the heart failure education. But then if you read these notes that these doctors put in, it's as if I'm the worst patient in the whole wide world. Refusing information, refusing this, refusing that, refusing this. I said no. I just don't want you to kill me. That's it. Professional attempted assassination, whatever you want to call it. More like criminal negligence. But here's the thing is that you got to be careful when you go into these doctors. This is my latest experience. This is coming from a person that would go to the doctor once every 2 years. I didn't expect to get influenza. I didn't expect to be thrown into this whole scenario. And I didn't expect my heart rate, heart function to go from less than 30% to 25% on one side after allergic reaction to medication. To now, the latest is what 20% on both sides. So, 20% means I can beat you home. I can beat you home. I can go in any day. But this is my point of all this is this. You have to know your body. You have to know the body of the person. You have to follow up. Their little systems and checks and balances don't work. And you have doctors that are, some of them, a lot are just one-way talkers. They're telling you what they're going to do and what you going to receive, and that's it. And then there isn't that two-way talk. That's hard to deal with. But thankfully, God's been good. He's been keeping me. So be careful when you go to the doctor. That miracle cure, if you depend on the doctor, I'm finding alternatives to this stuff because it's side effects of these medications are just crazy. And once you're on them, you definitely have to keep going back to your primary care or wherever it is you see, because they have to take blood work to follow up on those side effects. And that's what's scary. And it's scary that I question my doctor and I'm thinking I'm gonna go be discharged with oxygen as a PRN used as needed, but didn't even get that. If you're talking about just changing my CO2 level in my blood because of these medications, and they know these things. That's why they start checking you on a regular while you're in the hospital, because they know, hey, this might change this level, this might change that level. Calcium level is gone. What the hell? Jeez, what the hell do these things do? Well, the good does the bad. Seems like I have a question whether or not the good outdoes the bad. Anyway, take care of yourselves. Be careful out there. The medical system is more than one hospital. And if you're allergic to something, you gotta follow up. Make sure you look at the meds. You look it up, and don't let them, because they'll do you wrong. Some doctors are better than the others, and a lot of them, the last two that I had, Monday and Tuesday, just the one-way conversation. I'm telling you what I'm going to do to you, regardless of your cooperation or your consent. Wow, that's crazy. Take care.